Did you know that certain everyday habits can interfere with how amlodipine works and even put your heart at risk? Today, we're uncovering 5 critical things you should avoid right now if you're taking amlodipine, so you can get the most benefit and stay safe. No complicated medical jargon or overwhelming lists, just simple, clear advice that could make a real difference in your health. If you're 55 or older and rely on amlodipine to manage your blood pressure, this information is especially important for you. The choices you make every day, from the foods you eat to the medications you take, can have a surprising impact on your heart. Understanding these factors empowers you to take charge of your treatment and avoid unnecessary side effects like dizziness, dangerously low blood pressure, or worse. By the end of this guide, you'll have a clear, practical plan to protect your heart and get the most out of your medication. So, if you're ready to take control of your health and avoid hidden dangers, stay with us. This might just save your heart and your life. First up, grapefruit and grapefruit juice. One of the most unexpected but serious things to avoid when taking amlodipine is this seemingly healthy fruit. Grapefruit contains natural compounds called furanocoumarins, which interfere with enzymes in your digestive system that are responsible for breaking down amlodipine. This means more of the drug stays in your bloodstream for longer than it should, leading to dangerously low blood pressure and increased risk of side effects, such as dizziness or fainting. Even one glass of grapefruit juice can cause a significant spike in amlodipine levels. For older adults, this poses a major risk because fainting or falling due to low blood pressure can lead to severe injuries. And it's not just fresh grapefruit. This applies to all forms, including juice, supplements, or dried slices. Importantly, this interaction is unique to grapefruit and certain citrus fruits like Seville oranges. Regular oranges and lemons are safe and don't cause this issue. For instance, Dorothy, a 72-year-old from Ohio, used to drink grapefruit juice every morning. After starting amlodipine, she began experiencing dizziness and very low blood pressure. Her doctor explained the interaction, and once she stopped consuming grapefruit, her symptoms improved dramatically and her blood pressure stabilized. This example shows how understanding even a small detail can protect your heart and prevent complications. Next, let's talk about excessive salt intake. It may sound basic, but monitoring your sodium intake is absolutely crucial when you're on amlodipine, especially for seniors managing cardiovascular health. Sodium causes your body to retain water, which increases blood volume and adds strain on your heart and arteries. This directly counteracts the effects of amlodipine. So even if you're taking your medication regularly, a high-sodium diet can make it much harder to keep your blood pressure under control. Making conscious choices about salt, like reading labels, avoiding processed foods, and using herbs for flavor instead, can dramatically support the effectiveness of your treatment. Seniors are especially vulnerable to the effects of salt because, as we age, our kidneys become less efficient at filtering out excess sodium. This diminished ability leads to water retention, which increases blood pressure and puts added strain on the heart, potentially leading to serious complications. High sodium intake is strongly associated with a higher risk of heart attacks, strokes, and heart failure, exactly the conditions amlodipine is prescribed to help prevent. One powerful example is James, a 78-year-old retiree from Michigan who struggled to manage his blood pressure despite taking amlodipine faithfully. James loved salty snacks and frequently added extra salt to his meals, unaware of how this habit was undermining his treatment. After his doctor recommended reducing his salt intake, James noticed that his blood pressure began to stabilize and his fatigue lessened. The challenge is that sodium hides in many unexpected places. It's not just about avoiding potato chips or pretzels. Processed foods, canned soups, frozen meals, and even some breads can contain high levels of salt. For seniors with additional health concerns like diabetes or kidney disease, keeping sodium levels low is even more critical to prevent further complications. Reading nutrition labels carefully and choosing fresh, whole foods whenever possible can make a real difference. The key takeaway is simple. No matter how effective amlodipine is, too much salt can sabotage your progress and raise your risk of heart problems. Maintaining a low-sodium diet supports your medication, protects your heart, and helps you feel better day to day. This isn't just about numbers. It's about increasing energy, reducing fatigue, and enjoying a better quality of life. If you're still with us and finding this helpful, type number 2 in the comments to let us know you're here. And don't forget to subscribe and turn on notifications so you never miss a video that could benefit your health. Now, let's move on to the third thing to avoid: alcohol. While alcohol is a common part of social life for many, combining it with amlodipine can be risky, especially for seniors. Alcohol naturally dilates blood vessels, just like amlodipine does, which can cause an unpredictable drop in blood pressure when the two are taken together. This can result in symptoms like dizziness, lightheadedness, or fainting, dangerous outcomes for older adults who may already struggle with balance. Falls caused by these effects can lead to serious injuries like fractures or head trauma, drastically affecting mobility and independence. Consider John, a 75-year-old retired teacher from Colorado. He enjoyed a glass of wine in the evenings, but started experiencing unusual dizziness and weakness. His doctor helped him identify that the combination of alcohol and amlodipine was the likely cause. After cutting back, John's symptoms resolved and his energy improved. Beyond dizziness, alcohol can disrupt heart rhythm, increasing the risk of arrhythmia, something amlodipine is meant to help control. It may cause palpitations, chest discomfort, or even shortness of breath, symptoms that should never be ignored. Furthermore, alcohol affects how your liver metabolizes medications, potentially altering the levels of amlodipine in your system and interfering with its effectiveness. If you're serious about supporting your heart health, limiting alcohol is a smart and necessary step. Beyond direct drug interactions, alcohol consumption can lead to poor dietary choices, dehydration, and disrupted sleep, all of which negatively affect blood pressure control. For seniors managing multiple health conditions, these added risks can quickly compound. If you're someone who enjoys the occasional drink, it doesn't necessarily mean you must give it up entirely, but moderation becomes absolutely essential. The smartest move is to have an open conversation with your healthcare provider about what amount, if any, is safe for you. In many cases, the safest option might be to avoid alcohol completely while taking amlodipine to prevent unexpected complications. In summary, alcohol and amlodipine don't mix well. For seniors especially, the combined risks of dizziness, fainting, irregular heart rhythms, and altered medication levels make it far safer to limit or avoid alcohol. Protecting your heart means making wise choices, and reducing alcohol intake is a simple yet powerful way to safeguard your health. If you want to keep your heartbeat steady, your balance strong, and your medication working as intended, staying mindful about drinking is essential. Your well-being is absolutely worth that added caution. Now, let's look at number 4, over-the-counter cold and allergy medications. Many seniors instinctively reach for these common remedies when symptoms strike, unaware that they may be putting their heart at risk. Amlodipine is designed to lower blood pressure by relaxing blood vessels, but when taken alongside certain cold and allergy medicines, especially those containing decongestants like pseudoephedrine or phenylephrine, the effect can be reversed. These decongestants work by constricting blood vessels to relieve nasal congestion, but that very mechanism raises blood pressure, directly counteracting the benefit of your medication. This can cause sudden spikes in blood pressure, increasing the risk of heart attack or stroke, particularly in older adults. Take the case of Linda, a 68-year-old grandmother from Florida. She took an over-the-counter cold medication during flu season and was alarmed when her blood pressure readings spiked unexpectedly. After speaking with her doctor, she learned that the decongestants in her cold medicine were interfering with her amlodipine. Once she switched to safer alternatives and started checking labels more carefully, her blood pressure returned to normal. While some allergy medications that contain only antihistamines might cause side effects like drowsiness or dry mouth, they don't typically raise blood pressure. The real danger lies in combination products that include both antihistamines and decongestants. For seniors, even slight increases in blood pressure can be serious, making label reading a must. Another layer of risk comes from the fact that many seniors are already on multiple prescription medications. Adding an over-the-counter remedy without checking for interactions can unknowingly trigger harmful side effects. Always consult your pharmacist or healthcare provider before starting any new medication, even if it's available without a prescription. Fortunately, there are safer alternatives. Natural remedies like saline nasal sprays, steam inhalation, or allergy-proofing your home can relieve symptoms without affecting your heart. Your doctor can also recommend symptom relief options that won't interfere with amlodipine. The key takeaway is that over-the-counter doesn't mean risk-free. A simple cold remedy could quietly sabotage your blood pressure control and jeopardize your heart health. By staying informed, reading ingredients, and asking questions, you protect yourself from unnecessary setbacks and keep your treatment on track. Taking amlodipine means you're making a serious commitment to protecting your heart, and that commitment extends to everything you put into your body. Being cautious with over-the-counter medications is a small but powerful way to ensure your treatment works effectively and keeps your heart functioning at its best. If you're still watching and finding this helpful, comment number 4 below to let us know you're here. And if you haven't subscribed yet, be sure to click the button and turn on notifications so you never miss important health updates. Your support helps us keep creating content that informs and inspires. Now, let's move on to number 5. Missing doses or abruptly stopping amlodipine. When it comes to managing blood pressure and heart health, consistency is everything. One of the most dangerous mistakes seniors can make is skipping doses or stopping their medication without consulting a doctor. Amlodipine works by gradually relaxing the blood vessels, reducing pressure, and easing the heart's workload. But it needs to be taken regularly to maintain these effects. When you miss a dose, the level of medication in your body drops, which can lead to a rebound in blood pressure and strain on the heart. For seniors, whose cardiovascular systems may already be weakened, this can result in serious consequences. Stopping the medication suddenly without medical supervision is even riskier. Your body becomes accustomed to the drug, and removing it abruptly can trigger a rebound effect where blood pressure rises sharply, increasing the risk of chest pain, headaches, or even life-threatening events like a stroke or heart attack. Take George, an 80-year-old retired postal worker from Pennsylvania, who felt well and thought it was safe to skip his medication now and then. After missing several doses, he experienced severe dizziness and headaches, which landed him in the emergency room. His doctor explained how inconsistent use of amlodipine had put him in danger. After resuming his medication properly and setting up reminders, George regained control of his blood pressure. Seniors often deal with forgetfulness, multiple prescriptions, or unpleasant side effects that make it tempting to skip a pill. But solutions like using a pill organizer, setting phone alarms, or asking for help from a loved one can make a big difference. And if you're struggling with side effects, don't stop the medication. Talk to your doctor about adjustments or alternatives. Regular checkups and blood pressure monitoring are also key to staying on track. These visits give your doctor the chance to fine-tune your dosage and catch any issues before they become serious. Taking your medication exactly as prescribed is essential to getting its full benefit and protecting your heart. In short, never underestimate the importance of staying consistent with amlodipine. For seniors, this consistency is a vital part of healthy